it is these two processes that are routinely tested on the exam. Now, filtration versus reabsorption then is really driven by pressure differences. And because these processes are driven by pressure differences, they're often classified as bulk flow. Now, bulk flow is not an important term, but bulk flow refers to the movement of substances due to pressure differences. And filtration versus reabsorption are simply examples. Now, all the theory you have to understand is displayed in this figure. Now, on the handout, we do have an equation where you can calculate net filtration pressure or net reabsorption pressure, but it is more important for the exam to understand the individual variables. So that is our approach here, simply understanding the individual variables. Now, being very careful and starting at the beginning here, if this represents a typical capillary, this is the fluid inside the capillary. This is the fluid then in the interstitium. So we're looking about exchange across this capillary membrane. The first big point is filtration by definition is the movement of fluid from inside the capillary to the interstitium, and by convention, filtration is considered a positive directional movement of fluid. Now, people confuse these signs. This positive sign is not referring to a positive pressure. We're just saying that filtration is considered a positive directional movement of fluid. And if a variable supports filtration, it is given a positive directional sign. Now, on the other hand, if fluid moves from the interstitium back into the vascular compartment, that movement, of course, is reabsorption. And again, by convention, we consider this a negative directional movement of fluid. So reabsorption is considered a negative directional movement of fluid. Now, each of the variables we go through will either support filtration, that is, it will be given a positive directional sign, or it supports reabsorption, it is given a negative directional sign. And it is very important to understand that these are directional signs. We're not referring to positive or negative pressures. Now, there's 4 variables that affect filtration versus reabsorption. The first 2 are the hydrostatic pressures in the 2 compartments. Now, these are the 2 easier variables to deal with, so we'll start with these 2. Now, the first one listed here is the hydrostatic pressure in the capillary. Now, this is the blood pressure in the capillary. And the blood pressure in the capillary will try and push fluid from the capillary to the interstitium. Therefore, your blood pressure, your hydrostatic pressure in the capillary is a force promoting filtration. Is given a positive sign. The higher the pressure in the capillary, the higher the hydrostatic pressure, the greater the force promoting filtration. Now, the second hydrostatic pressure is the hydrostatic pressure of the interstitial fluid surrounding the capillary. Now, this pressure is also trying to push fluid. It tends to push fluid from the interstitium back into the capillary. And therefore, this is given a negative directional sign. The higher the absolute pressure, the higher the absolute pressure in the interstitium, the greater the force promoting reabsorption. So it's given a negative directional sign. Now, it's the last 2 pressures that are more difficult to deal with. Those are the osmotic pressures in the capillary and the interstitium. Now, we started dealing with the details in section 1. We said if you're dealing with the osmotic movement of fluid, you only count the particles that cannot penetrate the membrane across which the fluid is moving. And therefore, we're only dealing with particles that cannot penetrate a capillary membrane. Because sodium chloride readily penetrates a capillary membrane, sodium chloride has nothing to do with the osmotic forces then that cause movement of fluid between the capillary and the interstitium. We said earlier the only natural substance that cannot penetrate a capillary membrane are the plasma proteins. So it is the plasma proteins that determines the osmotic pressure. But you have to be careful here. You always have to be thinking about the concentration of the protein. The bottom line point is, the more concentrated the protein, the stronger the osmotic force. Now, most people think that these proteins suck fluid towards them. So the higher the concentration of the protein, the greater the sucking force of the protein. Now, the first of these two here on the model is the osmotic pressure of the capillaries. And as I said, this is determined by the concentration of plasma protein. The higher the concentration, the greater the sucking force, and this sucking force brings fluid into the capillary. Therefore, it causes the fluid to move in a negative direction. The higher the concentration of the proteins in the capillary, the greater the force promoting reabsorption or the negative movement of fluid. Now, the final variable represents the osmotic force in the interstitium. Now, the interstitium has very little protein. You are always filtering a small amount of protein, but don't forget this protein is removed via the lymphatics. Therefore, the interstitial proteins are kept extremely low. But these proteins will exhibit a small osmotic force. It is also a sucking force. Therefore, the interstitial proteins will tend to suck fluid from the capillary to the interstitium. Therefore, they promote a positive directional movement of fluid. Therefore, they promote filtration. Now, this is all the theory you have to understand to deal with the questions about filtration versus reabsorption. Now, what we're going to do next is we're going to apply this theoretical information to situations or examples or data that you may have to evaluate on step one. Now, one of the easiest questions for step one is to give you these four variables and the pressure associated with each variable. They have to be in the same units, and they'll usually give you the units as millimeters of mercury. So each of the four variables will have a pressure in millimeters of mercury. Now, your job first is to associate each pressure with a positive or directional movement of fluid, so you put the directional sign next to the variable. Now, the first one here is the hydrostatic pressure in the capillary. And this is a force that promotes the positive directional movement. So you put a positive sign next to this variable. The second one listed here is the hydrostatic pressure of the interstitium. Now, this hydrostatic pressure supports reabsorption, so that's a negative directional movement. You put the negative directional sign next to the number. The third variable here is the osmotic pressure of that capillary fluid. And that osmotic pressure supports reabsorption. So that supports a negative directional movement, so you put a negative sign next to the variable here. Now, finally, we said there are very few interstitial proteins, but they will produce a small osmotic force, and it's approximately here 1 millimeter of mercury. But this osmotic force of the interstitial proteins promotes filtration, so you put a positive directional sign. Now, what you have to do finally is to add up the directional signs. You add up all the directional signs to get a net pressure. If you add these together, you come up with plus 4 millimeters of mercury. If the answer is a positive number, then you have net filtration, and the net filtration here has a force of 4 millimeters of mercury. On the other hand, when you add up the numbers, if you end up with a negative sum, then you have net reabsorption, and the magnitude will be given by the absolute number here. Now, that is a very straightforward question on step 1. The only tricky part of this question is that every once in a while they may give interstitial hydrostatic pressure not as a positive pressure, but as a negative pressure. They may say the pressure in the interstitial fluid is minus 2 millimeters of mercury. And you have to have a method of handling a subatmospheric pressure in the interstitial fluid. Now, there's 2 ways of handling this negative pressure. One way is you just accept the negative pressure and you put the directional sign next to the number as you would if it was positive. The directional sign is a negative sign. So what you have is a negative before the number and a negative directional sign, and when you put these 2 together, you end up with a positive then. So if it is given as a negative pressure in the interstitial fluid, it becomes a positive when you add the numbers together. Now, that is the mathematical way of handling the number. I think it is important to understand the consequences of a negative interstitial pressure. Now, just follow me through on the reasoning here. If you have a negative pressure surrounding a capillary, what we're actually saying is you have a subatmospheric pressure surrounding that capillary. And you can think of that subatmospheric pressure as being a partial vacuum. So a negative pressure surrounding a capillary is a partial vacuum, and you can consider a partial vacuum to be sucking fluid out of the capillary. Now, the important point here is the more negative you have in the surrounding fluid, the more negative the pressure is in that surrounding fluid, the greater the force sucking that fluid out of the capillary, and the greater the force promoting peripheral edema. Now, this is a legitimate question for step 1, because you should realize, as stated in the notes, that in the thoracic cavity, we normally have a subatmospheric pressure. And that subatmospheric pressure is also surrounding the capillaries. So in the thoracic cavity, that subatmospheric pressure is a force promoting filtration. Now, the big important point to understand is, and we'll reemphasize this in respiration, when the thoracic cavity becomes more negative, when you create very negative pressures in the thoracic cavity, you have to understand that is a large force promoting filtration or the development of pulmonary edema. Now, the standard situation they test in step 1 is respiratory distress syndrome. Now, we will again talk about this in respiration. But in respiratory distress syndrome, you generate very negative pressures in the thoracic cavity. That is a strong force promoting capillary filtration or the development of peripheral edema. So that is a legitimate question for step 1 here. Now, I would go through and do the calculation. If the pressure is given as -2, then you should calculate a net filtration pressure of +8 here. And it is worth going through the calculation because people quite often come out with the wrong answer. Now, the last aspect of this section is to go through individual variables. They can give you specific situations on the exam, and you have to determine in these specific situations, are you more likely going to support filtration and the development of peripheral edema, or are you more likely to support reabsorption, the movement of fluid from the interstitium back into the vascular compartment? In these questions, you simply ask yourself what is happening to each of these 4 variables or to an important variable, and that leads you to the best answer. Now, we're going to take these one at a time here, and we're going to start with the most important variable, and that is capillary hydrostatic pressure. Now, don't forget, this pressure supports filtration. It supports movement in a positive direction. Now, what would tend to increase this pressure? What would tend to increase filtration? Now, one we already mentioned is arteriolar dilation. If you dilate the arterioles, then you will get an increase in capillary pressure, and that will increase filtration. A perfect example would be an exercising muscle. In an exercising muscle, you have dilated the arterioles, therefore capillary pressure is elevated and filtration increases. Now, during exercise, more specifically in the exercising muscles, lymph flow is much higher than under resting conditions. Why? Because the higher pressure in the capillaries causes more filtration, and this fluid is removed via the lymphatics. If you give a drug that vasodilates, then capillary pressure increases. That promotes filtration. It promotes peripheral edema formation. Now, the second situation, which is just about as important, involves venous constriction. Now, by venous constriction, we're specifically referring to a point constriction of the veins that raises venous pressure. Now, the best example that I could give you here is a pregnant woman. In a pregnant woman, the fetus will constrict the vena cava in the abdominal cavity. That will be a point constriction. It raises venous pressure in the dependent regions, and you have to realize that venous pressure will be transmitted back into the capillaries, and that promotes filtration. Another example that they could test on step 1 is putting a pressure cuff around the arm. And you blow this pressure cuff up to, we'll say, 20 millimeters of mercury. If you blow it up to 20 millimeters of mercury, you compress the veins at a single point, but you don't compress the arteries. Therefore, blood continues to flow into the arm. It flows into the veins. The venous pressure increases, and that venous pressure will back up into the capillaries and promote edema. This is simply talking about applying a tourniquet modestly to a limb. If you apply a tourniquet and you turn it, but not to the extent you compress the arteries in, venous pressure goes up dramatically, and that promotes peripheral filtration then. So that is an important situation. Now, if we consider situations in which capillary pressure decreases, again, we've already mentioned one, and that is arterial constriction in certain situations. If we consider situations in which capillary hydrostatic pressure decreases then, The main situation in which this pressure decreases is when you have arteriolar constriction. If you constrict the arterioles, then downstream the pressure goes down. Now, we already mentioned the situation in essential hypertension. If you constrict the arterioles, then upstream in the systemic arteries, pressure goes up and the individual is hypertensive, but downstream from the arterioles in the capillaries, pressure goes down. That promotes reabsorption. And I think most of you realize patients that have essential hypertension do not develop peripheral edema. The pressure is higher than normal in the arteries, but is generally lower than normal in the capillaries, and that promotes reabsorption. Now, the situation they're most likely to test is a hemorrhage. Now, one of the responses to a hemorrhage, as we mentioned earlier, was a peripheral vasoconstriction. And if your blood pressure goes down and you vasoconstrict, that means capillary pressure will definitely go down, and it may go down dramatically. Now, because capillary pressure goes down, then that promotes reabsorption. And the bottom line point is, after many hours, then you will have a shift in fluid from the interstitium to the vascular compartment. The low capillary pressure will cause a fluid shift from the interstitium into the vascular compartment, and that fluid moving into the vascular compartment will help compensate for the loss of fluid during that hemorrhage. So that is a very important, very simple situation to test on step 1. Now, the second variable here that we'll consider is capillary oncotic pressure. Now, this is almost as important as capillary hydrostatic pressure, but is also more complex and is more difficult to think through. Now, remember, we said the proteins in the vascular compartment then suck fluid and promote reabsorption. So what they will do is they will tend to promote a fluid shift from the interstitium into the vascular compartment. Now, if we look at situations in which capillary oncotic pressure increases, there's really only one situation they will test on step 1, and that is a simple dehydration, probably due to excessive sweating. But the same conclusions should be drawn if you take a look at the situation equivalent to acute diarrhea. Because whether you sweat or you have acute diarrhea, you are losing fluid, but you're not losing protein. Also, if you're forming a large volume of dilute urine, in most cases, you are also losing fluid, but not losing protein. Now, in all those situations where you're losing fluid, but not protein, the concentration of protein in the vascular compartment increases. And you should realize there's a larger sucking force to bring fluid from the interstitium back into the vascular compartment. And again, this would tend to compensate for that fluid loss due to the original insult. If you're walking around in the desert or you're exercising vigorously in a humid environment, you will lose fluid but retain the protein. And this will cause a shift from the interstitium to the vascular compartment. And again, it partially compensates for the fluid loss in these situations. Now, if we look at situations in which capillary oncotic pressure decreases, this will occur in certain liver and renal diseases. For example, if the liver is not able to manufacture proteins, then the plasma protein concentration decreases. And this usually occurs in most individuals who have cirrhosis then. you have a decrease in the concentration of plasma proteins. If in the kidney you're losing protein in the urine, that also usually means that eventually you have a decrease in plasma protein concentration. Now, this should be your reasoning here. If you decrease the concentration of protein in the vascular compartment, you lose some of your sucking force that's trying to bring fluid from the interstitium into the vascular compartment. Or looking at it in different terms then, you have a greater tendency for fluid to move from the vascular compartment to the interstitium. The bottom line point is, if the plasma protein concentration decreases for any reason, fluid tends to leave the vascular compartment for the interstitium.